Welcome to NCLEX RN exam practice test. Our topic today is management of care. Use the link in the description to download the app on the App Store for free practice tests. Number 1. What is not the nurse's role in informed consent? A. To witness informed consent. B. To obtain informed consent. C. To validate that the patient did indeed give informed consent. D. To educate the client on informed consent. The correct answer is B. To obtain informed consent. Explanation. Nursing role in informed consent is not to obtain informed consent. The physician is responsible for obtaining consent. The nurse's duty is to validate the patient's understanding that the patient did indeed give informed consent. The nurse usually witnesses informed consent and may educate the client on informed consent. Number 2. Which of the following is not an ethical principle? A. Adolescents are capable of making healthcare decisions. B. Privacy laws are only breached when the patient is endangering others with his or her decisions. C. All patients should be informed of the consequences of refusing treatment. D. All mentally sound adult patients have the right to refuse treatment, except for life-saving treatment. The correct answer is D. All mentally sound adult patients have the right to refuse treatment, except for life-saving treatment. Explanation. The nurse should know the 10 ethical principles that are used to govern court decisions regarding nursing and medical malpractice. One of these is that all mentally sound adult patients have the right to refuse treatment, including life-saving treatment. Number 3. All of the following are included in the Health Insurance Portability and Accountability Act, except A. Protection of patients' privacy. B. Prevention of patients from being denied insurance because of a pre-existing condition. C. Prevention of patients from sharing their private medical information with their insurance carrier. D. Creation of a standard to protect patients' health records among healthcare providers and institutions. The correct answer is C. Prevention of patients from sharing their private medical information with their insurance carrier. Explanation. The patient is entitled to share personal information with whomever they choose. HIPAA protects a patient's privacy and prevents that patient from being denied insurance because of a pre-existing condition. It creates a standard for privacy protection among healthcare providers and institutions and protects the patient's health record. Number 4. A patient comes into the emergency room with black eyes, red marks on the neck, hip fractures and lots of bruises over her body. She said that she accidentally fell down the stairs. What should the nurse do? A. Inform the law enforcement authorities, according to hospital protocol. B. Encourage the patient to report her injuries to the police. C. Assure the patient that no one will find out about her injuries. D. Refuse to treat the patient for suspicion of domestic abuse. The correct answer is A. Inform the law enforcement authorities, according to hospital protocol. Explanation. While it is true that patients have a right to privacy, the nurse is also responsible for reporting suspicious injuries. The patient said that she accidentally fell down the stairs, but the black eyes, red marks on the neck and lots of bruises over her body makes her story suspicious. Because the injuries may be the result of domestic abuse or violence, the nurse must make the report to the police department. Number 5. Which of the following is the third level of human needs? A. Esteem needs. B. Physiological needs. C. Safety, security needs. D. Love or belonging needs. The correct answer is D. Love or belonging needs. Explanation. Maslow's hierarchy of needs was created as a way to discuss the prioritization of human needs, comprising a 5-tier model of human needs. Love or belonging needs represent the third tier in Maslow's hierarchy and refer to the desire to belong to groups, be accepted, clubs, work groups, religious groups, family, gangs, etc. Number 6. Which term describes the idea that the nurse should do no harm to the patient? A. Veracity. B. Justice. C. Non-maleficence. D. Beneficence. The correct answer is C. Non-maleficence. Explanation. Non-maleficence is one of the 6 additional ethical principles that a nurse must maintain to be excellent in his or her practice, listed by the American Nurses Association. Non-maleficence is the principle of doing no harm. Number 7. Health maintenance organizations and preferred provider organizations are examples of A. Healthcare, B. Managed care, C. Case management, D. Quality improvement. The correct answer is B. Managed care. Explanation. Health maintenance organizations and preferred provider organizations are examples of managed care organizations. Managed care is a system of health care delivery and reimbursement. It involves a select panel of care providers who give out their services based on a prepayment arrangement between the provider and the managed care organization. Number 8. Which of the following tasks can the registered nurses delegate to the nursing assistant? A. Assisting a 73-year-old patient with a history of unstable gait to the restroom. B. Auscultating breath sounds on a 70-year-old patient with emphysema. C. Inserting an intravenous line into a 34-year-old patient's forearm. D. Taking vital signs on a 65-year-old patient whose blood pressure was last 80/46. The correct answer is A. Assisting a 73-year-old patient with a history of unstable gait to the restroom. Explanation. The key to proper delegation is to consider the 5 rights: right task, right person, right circumstance, right communication, and right supervision. In the delegation tasks above, a nurse must not delegate tasks of auscultating the heart sounds and inserting intravenous lines, as these are outside of the medical assistant's scope of practice. The patient with the low blood pressure would be considered unstable and should be assessed directly by the nurse. So, assisting a 73-year-old patient with a history of unstable gait to the restroom is appropriate to delegate to the assistive staff. Number 9. 2 nurses are discussing a client's lab results in the cafeteria. Which of the following legal processes did the nurses violate? A. HIPAA, B. Healthcare Proxy, C. Patient's Bill of Rights, D. Patient Self-Determination Act. The correct answer is A. HIPAA. Explanation. The Health Insurance Portability and Accountability Act, HIPAA, is a law designed to protect patients' personal and health information. Nurses can violate HIPAA by speaking about or sharing private patient information in public areas, like the cafeteria, or with unapproved caregivers. Number 10. A nurse arranges for a translator to be present prior to a conversation with the practitioner regarding the diagnosis and treatment plan for a non-English speaking patient. Which ethical principle is the nurse demonstrating? A. Veracity, B. Fidelity, C. Justice, D. Beneficence. The correct answer is C. Justice. Explanation. Justice is one of the 6 additional ethical principles that a nurse must maintain to be excellent in his or her practice, listed by the American Nurses Association. The principle of justice involves fair treatment and equal care for all. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.